In the month of July, we get together to spread awareness about a rare cancer, also called a forgotten cancer, sarcoma. Sarcoma is a tumor arising from connective tissue within your body. It could be bone, cartilage, fat, muscles, nerves, or blood vessels. Namaste, I'm Dr. Nitin SG, consultant medical oncologist. Sarcoma is an aggressive variant of cancer which is rarely seen in adults. It constitutes only 1% of the adult cancers, and it is more commonly seen in children, especially bone tumors as well as muscle tumors. There are at least 70 different subtypes of sarcoma, and hence the diagnosis of sarcoma is very difficult. If diagnosed at an early stage, it could be completely cured and could be treated very well. But advanced stages of sarcomas are very aggressive and difficult to treat. There are multiple different types of sarcomas, as I told, based upon the site or type of tissue where it arises from. But predominantly there are 4 types or 5 types. The one arising from bone could be osteosarcoma or Ewing sarcoma. The one arising from the cartilage is chondrosarcoma. Arising from the fat is liposarcoma. From the muscle it is called leiomyosarcoma, which could be from a smooth muscle of uterus or any other organ. What are the symptoms of sarcoma? There are mainly 5 alarming symptoms that should make you think that it could be possibly a sarcoma. One is a swelling arising from your bone or a joint or any part of your body that is progressively increasing in size and often associated with pain. Second symptom is pain, a persistent pain that is slowly increasing and progressing even with analgesics, painkillers, it is not improving, and a pain that is persistent especially through night time could be an alarming sign of sarcoma. Another symptom is especially associated with bone tumors is that a person might get a bone fracture even with a mild trauma. A trivial trauma can lead to a fracture, and this could also be a sign of bone sarcoma. It could also lead to a swelling in the abdomen or any other body part according to where the tumor is arising from. Other symptoms include generalized weakness and fatigue, excessive fatigue which is not improving even with all the treatment, and generalized weight loss or excessive weight loss, significant weight loss in the last several months. How to diagnose sarcoma? Diagnosis of sarcoma is quite challenging. You might get a tumor or a mass in one part of your body. You will get a CT scan or MRI scan to look the extent of the disease. But the main challenge is pathology. You always do a biopsy of the tumor to make a confirmation of which type of sarcoma it is. As I told, there are multiple different types of sarcoma, and many of these might appear similar under microscope, and hence an expert pathologist is needed to make a diagnosis of sarcoma. So make sure that if you are getting treated for sarcoma, always make sure that it is in a center where there is a good pathology team or a sarcoma team which includes medical oncologist, surgical oncologist, orthopedic surgeon as well as a pathologist. Another important point is that while taking biopsy, it should always be taken by a doctor who's going to do a surgery later in your sarcoma, because he'll take biopsy in such a way that the biopsy scar and everything would be removed during treatment of that tumor. Staging of sarcoma, as similar to other cancers, we do by CT scan, PET scan and MRI, and if it is advanced stage, we'll have to go for palliative treatment. Treatment of sarcoma. So early stages, as I told, stage 1, 2, we often go for surgery followed by either chemotherapy or chemotherapy and radiotherapy. Stage 3, often we might do a chemotherapy in the initial phase followed by surgery, or surgery followed by chemotherapy and radiation. Stage 4 cancers are often advanced and difficult to cure by a single modality of treatment. Often we have to resort to palliative chemotherapy, and nowadays in sarcoma also there is a role of personalized cancer therapy with doing a molecular testing and identifying specific genetic changes. For example, sarcomas like Ewing sarcoma and various other sarcomas have got specific or notable genetic changes that can be identified, and accordingly a targeted therapy can also be provided to the patient. Sarcoma, as I told, is very aggressive, and if identified at an early stage could be completely cured. So if you come across anybody who has got symptoms suggestive of sarcoma, advise them to consult a doctor at the earliest, and always make sure that you are getting treated at a center which has expertise in treating sarcomas. Thank you.